Nobody's there.
There's people there.
Just for writing in.
Right. With my pen, please.
Where do you want that?
Over there. Yeah.
Hello. Did you see if you were in the picture?
Over the past 25 years, J.C. Wagner has helped customers convert their structured settlements into large.
How am I not in the picture?
And we're here now.
She's on the picture right now.
I wish I knew.
And they can hear you.
Yeah.
I'll grab your you don't want lemonade for later.
Yeah.
All right. Say good morning, Ingrid, but
Was Brad and Cindy planning on to attend today?
I did speak with Brad this morning and he was going to be calling in. Cindy has a meeting conflict and so she won't be in right away. If she's able to, she'll join into the meeting a little bit later.
Right. Do you have everybody here that you need here to start the meeting?
I believe so. I know there may be a few others joining, but I think we're okay.
All right. I'm gonna go ahead and call this meeting to order of the Health and Human Services Board. First on the agenda was welcome Brad Wagner and Cindy Chicker. Looks like Brad's not on the line by phone yet. Brad is the supervisor for Richland County, his third year with the County Board of Supervisors. He's taking Peg Call's place. She recently resigned from the Health and Human Services Board. And then Cindy Chicker, who was recently retired from the hospital, has taken the citizen member's position in the Health and Human Services Board. So with that, I guess, was this meeting properly posted? Noticed?
Yes.
Alrighty. I will entertain a motion to approve a 19-point agenda.
I second that, Debbie Glasser.
Debbie will make the motion. Is there a second?
second.
All right, Mr. Nelson seconds. All those is there any discussion on the agenda? All those in favor signify by saying aye.
Aye.
Opposed? Motion carried. Is there any discussions, additions, corrections to the September 10th, 2020 Health and Human Services meeting minutes? Hearing none, I'll declare that those minutes be approved as printed and distributed. Are there any citizen comments come before the board? Any citizen comments? Hearing none, we'll move down to agenda item number 5, election of the secretary. Who was the secretary? Was Peg the secretary before?
Yes, I believe so.
Right.
Oh, Angie's correcting me.
No, it was Ingrid. So when she took vice last month, that freed up the secretary spot.
Thank you.
Yep.
All right. So the office of secretary is more or less like a chair pro tempore. So in the absence of the chair and the vice chair, the secretary then would chair the meeting. And if we need to have notes taken at any other time when there's not a secretary, they would fill in for that. So would we have any nominations for the position of secretary? Would we like to wait on that till we have Cindy and Brad available?
I think let's wait. Are neither of them are joined right now?
Neither of them are on here right now. I think the secretary should be somebody who's been on the board little bit longer than just some newer members, but my opinion, either Van or Dr. Barris. Debbie, do you want to be the secretary?
I'm gonna be leaving in April.
Okay,
My term's up.
Mr. Chair, I would point out that the secretary, we always have somebody to take minutes except for when the board might go into closed session. And so then the minutes requirement would be pretty limited as to needing to just indicate who made motions so that we can put them back into the official minutes.
Dr. Barris, are you interested?
I don't know if I'm interested, but I won't refuse it.
Well, I'll nominate Dr. Barris.
Okay, we have a nomination for Dr. Barris. Is there a second?
Debbie,
Second.
second.
All right, so we got a nomination by Ingrid. Debbie seconds that nomination. Are there any other nominations?
I move the nominations be closed, unanimous ballot cast for the doctor.
Motion by Van Nelson to close nominations and to cast a unanimous ballot for Dr. Barris as Secretary of the Health and Human Services Board. Is there a second? Is there a second on Mr. Nelson's motion? I'll second.
Second it.
I'll second the motion. Is there any discussion on the position of Secretary being offered to Dr. Barris? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion carried. We'll move on to agenda item number 6, amendment to the Health and Human Services Board structure. This would be in our folder under summary number 1. Angie, are you leading this?
Sorry, lost where I could unmute. Sorry. Tracy, I think it's really more under you.
Yeah, I can speak to it. I shared my screen. Do you see the summary in front of you?
Yes, I do.
Okay, just I didn't see that it switched over. So essentially, when Ingrid moved on to the county board, and because she had been filling that nurse position, there was some question about, was that open position a position that was could only be held by a nurse? We did attempt to recruit a nurse for the position. We were not successful with that. We then also put out an ad to recruit just a member. And I think then it caused us to take a closer look and consult. I think Victor had raised the question whether or not that position must be held by a nurse. We reached out to our corporation counsel, Ben Southwick, and he made a recommendation about changing the board structure. The statute indicates that for a board of health, we need to have a physician and a nurse, if possible, is how it states. This board handout does show you the statutory language. I'm going to just scroll down to that for the moment. Mr. Southwick recommended that the language be changed because our board structure actually is more strict than what the statute says. And so this handout this summary is being put to you with the recommendation to change the language of the summary, the structure for the Health and Human Services Board that would allow us, if we were unable to recruit a nurse or a doctor, it would allow us to fill that seat with another individual. I'm going to scroll back up to the proposed language for the board structure change. Mr. Southwick also recommended changing the language in item number C. So that's the recommended language that he provided. And one additional change in item number E, the Health and Human Services, I think it's the rules of the county board indicate that Health and Human Services can have contracts approved by this board up to $50,000. And I believe it was an oversight that the language didn't change on the board structure. And so the proposal would be to amend that as well.
You heard the description of our changes to the Health and Human Services Board structure rules. This will be forwarded onto the Rules and Resolutions Committee from this committee to recommend to the county board after they've looked at it. What is the committee's pleasure?
I would make a motion to approve. Is that what we're looking for?
Motion by Mrs. Glassbrenner to approve this document and forward it on to Rules and Resolutions Committee. Is there a second?
I'll second.
Seconded by Dr. Barris. Do we have any discussion, amendments or corrections? Hearing none. All those in favor signify. Opposed? Motion carried. We'll move on to agenda item number 7, the director's report.
All right, thank you. I'll start with some news from our program units. The Children and Youth Services, Child and Youth Services unit has been seeing significant increase in abuse and neglect reports over the last 3 weeks. We usually expect to see an increase in reports during the beginning of the school year when children are having more contact with mandated reporters, but we're also seeing increase in reports from private individuals as well. So our staff are responding and investigating the information that's been reported, but just wanted you to know that there's an increase in that. Behavioral health staff will be providing a presentation to the Yuba first responders on crisis debriefing and secondary caregiver stress reduction. That'll happen later this month. The COVID-19 first responders support line continues to be available to emergency and medical responders. It's set up to provide assistance with decompressing and debriefing from the stress of their work. Responders can access the support through the crisis system. Mental health professionals are available to provide support during our regular office hours. In the ADRC, the transportation program will be having its annual 8521 public hearing on Wednesday, October 14th at 3 o'clock. The purpose of the public hearing is to get input on the 2021 Specialized Transportation Grant funding offered by the Department of Transportation. The hearing will be offered for both in-person input or via Zoom. EDRC is providing a weekly virtual Powerful Tools for Caregivers workshop through the end of October. Also working with regional dementia care specialists and our other partner counties to provide a virtual caregiver boot camp event for National Caregivers Month in November. This is a free educational series for families coping with Alzheimer's disease and other dementias. Sessions will be held via Zoom every Monday in November from 1 to 3 p.m. Each week we'll highlight a different topic, including Let's Talk About Dementia, Tough Conversations, virtual steering into the skid, one act play, dementia friends, services and resources. And speaker Carrie Olson will do a presentation titled Taking Care of You. Economic support has been recertified by the Centers for Medicare and Medicaid Services as an application counselor designation organization for healthcare enrollment in the marketplace under the Affordable Care Act. This allows us to function as a no wrong door for individuals seeking healthcare options. Open enrollment for the marketplace will be November 1st through December 15th. Emergency supplemental food share for October will be issued at the end of this month. Emergency supplements bring households up to the maximum allotment allowed for their group. The Richland Area Child Care Task Force received 110 responses in a recent parent survey that was conducted. The task force shared the results with the state entities that are completing strategic planning. The primary goal of the local task force is to support current and new providers and to increase the number of regulated providers in our community. The group is also participating in the planning of what will be called a Child Care 101 virtual event. Potential providers will be invited to learn about what it would take to become regulated. And then I know Rose will be talking more about the current status of the pandemic, but I'd like to share what Health and Human Services is doing in the face of significant increase in the spread of the virus that we've seen over the couple of weeks. I did put into your iPad folders a data sheet on the current status of the COVID-19 cases in Richland County. Data is showing that Richland County is approaching exponential growth in cases. We're really seeing it shoot up. As an agency, in order to reduce the spread and protect our clients and staff, we're emphasizing increased focus on providing services by virtual means wherever appropriate. We've increased our remote work options for staff where it is possible. We're ceasing in-person meetings between staff in the office, encouraging staff to communicate entirely by phone and video chat in order to reduce person-to-person contacts. And in some units, staff teams are formed and are in the office on alternate days in order to mitigate the risk of exposure to the whole unit. Currently, Health and Human Services has 6 staff who are either in isolation, quarantine, or are awaiting test results. We're very aware and concerned that, in some of our program units, if 2 staff end up being taken out due to needing to be in isolation and unable to work, that would severely impair our ability in those programs. And so we're trying to be especially careful about keeping our staff safe from exposure. And that's all I have for a report. Are there any questions for me?
Are those 6 staff, Tracy, are they using up their sick leave, or is that something that the county's not allowing them to do?
Well, it's probably varying for each staff person depending on where they stand, but they are able to use sick leave if they need to. Our new I think our COVID-19 plan allows them to go into a negative balance with their sick leave if they don't have enough. Some staff may qualify for the family leave option that would allow them to continue to be paid. So each staff person is in a little bit different situation.
Any other questions for Director Thorson?
Excuse me, Mr. Chair, I should note too that some of those staff, if they're under quarantine and not ill and unable to work, they are able to work from home.
Any more questions? Hearing none, we'll move on to the health officer update and COVID-19 response. Rose, are you ready to give a presentation?
I am. Thank
Alrighty.
you. As Tracy indicated, our numbers have grown exponentially, and we were noticing that even last month. But what we have noticed here during the first week of October is that the numbers of confirmed cases in the first week of this month have outstripped the entire last month numbers. So, I mean, if we looked at it as of the other day, we actually had in 1 week had actually it's a 400% increase when you think about it in the numbers, because if we spent 4 weeks in September getting to a certain amount and we had that amount and have now exceeded it in 1 week, yeah, we've seen that much of an increase. The impact on the community is great, given the numbers of infected individuals, household contacts, and other individuals who've been in contact with those folks. So yes, COVID has definitely cast a broad net across the entire community. And so, and as a result, the workload here in public health has increased just as much. Last week, we made the decision to change the mode of operations here in public health. A press release was put out to media outlets, and it indicated that based upon the fact that we have been and continue to be operating in crisis mode, we are looking now at the prospect of contacting just those individuals who have tested positive, and then also getting in touch with their household contacts and setting them up as contact investigations. However, even this morning, I am concerned that even with the number of household contacts that we are investigating, it is getting to the point where that's even outstripping our capabilities. So we're looking at it very closely. There is very, very little downtime. There hasn't been a lot of downtime in the last 6 to 7 months. However, now it's just become much more difficult. And the burnout potential is significant. I guess I can't, that's exponential as well. I guess I can't understate the importance of taking care of our staff, because if we don't, we won't have any. And statewide, I've definitely seen and I've heard about the prospects of public health losing leaders and staff on a pretty consistent basis. People cannot keep this level of work and the level of capacity up indefinitely. So we need to take good care of our folks, and I'm more than willing to do that to try to preserve the integrity of our particular office, our public health office, but also to ensure that we have very capable staff, but make sure that they've got the time away that they need without the worry of without the worry of work going home with them, because that does not happen right now. So I just want to make sure that you understood maybe the gravity of the situation. And again, we're hoping that by changing our mode of operations, it may result in some ability for our staff to kind of preserve their capacities. However, that will remain to be seen. Again, as you can well imagine, there is a directive that influenza vaccine be provided at the earliest opportunity for folks in our community. And I know that there was the thought that it should be completed on or around the 31st of October. And the reason for that would be if the potential exists for us to receive COVID vaccine, if and when that becomes available. I think there was a thought that the influenza season, at least the immunization portion of that, should be behind us, so that we would be able to mobilize resources to provide COVID vaccine if and when that comes to pass. Now, information I've received is that if indeed, and again, it will, that particular vaccine will come out in smaller amounts initially, and it'll be prioritized. So I'm not quite sure how much we would see here or how soon. I haven't received any recent information on that, to be honest. However, the expectations on handling of that particular product, as well as the fact that there might be a booster required, that's kind of what we're hearing. That would indicate that for each individual who qualifies for a vaccine, they'd have to have a second. So that, it kind of doubles that work effort. So we're looking at that. And then, as I mentioned earlier during a meeting, public health continues to get, the things that we get, for example, like animal bite orders or maternal child health referrals and things of that sort. So we're working very hard to try to make sure we're managing other aspects of public health that are as essential as the COVID response right now. So just want to kind of give you an update of kind of what our local conditions are like here in our office. Any questions at all?
Anybody have any questions for Rose?
Yeah, Rose, I know it varies on each case, but on average, how long does it take for contact tracing for each positive?
Okay, we prioritize confirmed cases at the beginning of each day. In fact, I check every evening, of course, and we do have a few staff that work into the evening at this point, but I'm usually checking probably as late as 9:30, 10 o'clock, or even 10:30 or later. We'll see what we have sitting there. Those are looked at and are usually pulled in and assigned the very next morning. And in fact, we do our best to, within a 24-hour period, to contact confirmed cases. And right now, we have just been limiting, creating contact investigations to just the household contacts. And then we're requesting that those who have tested positive get in touch with other individuals that they would deem to be close contacts and provide them with quarantine information. Our website has a really nice resource, and it goes through any type of scenario that a person might be interested in knowing, whether they are ill or have been exposed. So yeah, usually within 24 hours is where we're at. However, the press release and the guidance that we received from the state indicates that the potential does exist that if we just cannot get in touch with people, and that is not our thought, of course, but if we could not get in touch, people that potential exists that a confirmed case might not get a call. However, we are not engaging in that particular type of operation at this point.
How many cases do you have now?
Well, as of this morning, let me take a look here. My mind is not as what it used to be. But as of yesterday afternoon, we had 243 positive cases of COVID-19 here in Richland County. And that, of course, I saw this morning that, what was positive already. And so we do have to kind of winnow that a little bit. We get information that comes in, but sometimes the demographic information indicates that that individual may live somewhere else outside of the county. So knowing what the net number is right now, I can't tell you as of what we have seen this morning. From what I saw, there were maybe 3 individuals that might live elsewhere, but we have to confirm that first before we would reach out. But yeah, so as of yesterday afternoon, 243.
What age range does that have?
Well, I know that the highest age range right now, folks who are impacted, and Tracy's going to bring up that, you can see right now our numbers. There it is.
Let's keep going. A stunning move now, just 26 days before the election. President Trump says he will not take part in the next.
Yeah, so it looks like, 6 under the age of 10, 22 between 10 and 19, 51 between 20 and 29, 51 between 20 and 39, and it goes down a little bit more. And again, this report is in your iPad folders as well.
I'm not going to waste my time on a virtual debate. That's not what debating is all about. Right?
Do you need help in your office, Rose? Should we be looking at possibly getting some more part-time clinic nurses or public health nurses involved with the
Right now, including myself, we have 3 full-time public health nurses. My time is a little bit divided, and I'd love to be even more helpful to the staff, and I try to be. I do take every 3rd weekend, and then I also work through the day too to pull in as much as I possibly am able to, although I don't feel as if I'm carrying the weight of that workload like our other 2 full-time staff are. We are very, very fortunate to have another nurse who's working part-time who has done incredible work, as have some of our own health and human services staff who have agreed to help us as public health assistants. We do have an additional 6 staff here who have expressed an interest in also assisting us. We're just waiting for them to get access to the state system and to get that orientation set up. We had orientation set up, however, given the numbers of individuals and the fact that they did not have access to that state system yet, that kind of slowed that down a little bit. But we do have another 6 that we're hoping to be able to get up and running real soon. We're also hoping that they can begin, that process very soon of maybe managing those tests that come in negative. It gives them really good experience with working with the system. Right now, I'm hopeful that that those additional 6 may be able to help offload the COVID work, so that perhaps our own public health nurses can actually begin the process of, again, all 3 nurses were at the fairgrounds yesterday, so that took us out of the office at least half a day yesterday. But we did need that level of help given the numbers of folks that we saw for that flu clinic. But yeah, just having that flexibility, being able to go and get in contact with someone who's had a new baby who might be interested in a home visit. Not everyone is, but making sure that we connect with those folks, and we just don't want to not be available for those particular needs. So I'm hoping that these additional 6 staff will be able able to kind of maybe help free up some of the public health nurses for not only the COVID work, but for additional work that we see too.
So just to add to what Rose is saying about the staffing, what we've done, we've reached out and we've hired some part-time LTE staff. And then when we were on the verge of looking to doing that again, we decided to offer additional hours to our existing staff. We have quite a few staff here who certainly have the skill set necessary to do some of the contact tracing to help out. And so I think we have 3 staff that we started with who got training, and they're doing their regular job during the day, and then after hours they're coming in and, well, perhaps coming in or working remotely after hours and on weekends to get assigned cases. So those 6 additional staff also stepped forward. We actually had more than 6 people step forward, but we're trying to have a manageable number that can be supervised through public health. So once they're trained and oriented, they will also be able to help out. We have staff on a list who are willing to help if we need to expand that. But it's still a lot on the public health nurses' shoulders in terms of overseeing and making sure everything that needs to happen is happening. And I know Rose didn't say this, but I know Rose is doing everything she can to help out the nurses with all of the regular public health nursing work, but she's also consulting and talking with all the school districts in the area, as well as industry, and helping to advise them on some of their questions related to how they're dealing with the pandemic. So she's pulled in all different directions. Rose is really everywhere, it seems like right now.
Like a bad penny, I keep showing up, so yeah.
What is the Emergency Operations Center like at the state level? Like, what are they saying? And are they offering up any assistance as far as different supplies or anything?
Yes, we have been relying on our state EOC partners for the pretty much all of the PPE and disinfection products that we've been getting and distributing. In fact, on a weekly basis, a request is submitted to the State Emergency Operations Center. They take a look at that, and then we actually get PPE, and whether it be masks, gloves, and the like, each week that we are able to, that is staged at our local EOC area, which is for us in the emergency management office. And then as requests are made for that particular type of, for those items, those are distributed from the emergency operations, well, from the emergency management office. So yes, the state EOC has been very instrumental in ensuring that we have an ongoing flow of PPE here to our local folks who need it. And then they're also a point of contact as well. We work with the state EOC and some of the Department of Health Services staff if we're looking at any type of National Guard support and things of that sort too. So they are partnering with us in those endeavors.
Mr. Chair, I'd like to also, I kind of neglected to mention this, but you know that we have weekly community testing, free community testing for COVID-19 occurring. And we have 3 staff every week going out and helping to support that effort. Again, this is staff who have stepped forward and volunteered to help out with that event, along with the ambulance crew who's doing that. So everybody's stretched pretty thin with that, but that's one of the things I think the community has really responded to. I think for the last 3 weeks that they've done it, they've used up the tests that they can do.
Any more questions for the health officer? Thank you, Rose, for doing all the work that you're doing. It's very appreciative. Well, we'll move on to agenda item number 9. Review and approve Health and Human Services vouchers. Who's handling this today?
Andy's going to handle this.
with their kids on virtual, hybrid. There's so
Okay.
much going
I think someone's TV's on in the background. I don't know if you guys can hear me. Okay, so vouchers today. So we have over 34,000 is what the first page explains. And we'll go through and a few that I've noticed that need to be highlighted. Mileage are the first few pages. 34,000 is quite low. This meeting is very early this month. So I know personally, a lot of the bills that we get for normal garbage collection and things like that, we might not have gotten this month yet. So next month's vouchers might be a little higher than what an average month is, just because a lot of those will be pushed over into November. So if we look at page 3, yep, that's what's up there. That's the first page I wanted to look at. In the middle, I wanted to point out there, that is where card member services starts. I don't know if any of the new board members are on. Tracy, can you tell if I need to?
Oh, we did have someone join by phone. That may be
Yeah, I
great.
heard that. Okay.
I believe
Okay.
that's Brad, because that's the last 3 digits of his phone number.
Okay, so I'll explain a little bit more then. So from the left-hand column over, you see a PO number kind of all the way in, kind of starts at 20 on the top and works its way down. I don't know, Tracy, if you can highlight where I'm at. Yeah. So 23 is where I wanted to mention. Card member services is our agency credit card. So you can see there's a number of items in a row there, I think of roughly 6 or 7 that are card member services. I wanted to highlight 23 and 24 together equal our Cario behavioral health EHR system bill every month. So while that seems kind of large, on the credit card, that is a routine monthly charge of for that EHR that we have. If you go down a little further from there is the number 26 voucher for $1,260. That is also for our behavioral health clinic. It's for the Smart Vault, which is a secure file sharing application for our CCS program, and that's an annual charge. So you'll only see that once in a while. So then you'll see the total for the credit card bill. See the vendor total down from that is $3,471.26. That's the total for all of the card member services charges. So all the charges to our agency credit card bill is what that total is, not just one total for $3,400. It's the sum of all of that column on the right. Okay. It's the only ones I wanted to point out on page 3. It's page 4. There's a lot more on here I wanted to point out that are new and kind of things that you might not have seen before. So the 4th one down from the top is number 12. You'll see Johnson Controls. There are 2 charges there for 2 separate things. The larger one was the our fire alarm in our building it's that sprinkler inspection that we talked about actually back in August. So they had conducted that. I had talked to you guys about what that looked like and what we were facing here, and that was the bill that came through. Also, just below that, they did a fire alarm monitoring that they do. That's the $210 for the annual monitoring. So the total payment to Johnson Controls is that $1,857.78. And like I mentioned, those were all previously approved and talked about in August this year. Just below that is another rather large bill this month that is to Language Line Services. And Language Line is our interpreter services that we use over the phone. We do have some in-house on retainer Spanish language interpreters that can go to appointments and things that are local, that we have them on call. But this is actually for not only Spanish speaking, but other languages as well that we run into. I think this one, the $93 charge was for Arabic or something. But the larger one, the $614 one charge this month was largely due to public health. And you'll see the codes in the middle, see where it starts with code 34.5440. That means it's a COVID expense. So public health doing some contact tracing is my assumption, is why that's so large. So the bill for Language Line this month was $708. Usually it's about $55. So that's quite large increase. Right below that, keeping going, there's another voucher number 14 and 15 is our Marco Holdings. Those are some large charges this month. They are the first one, the $1,445 is actually something you approved in July. That was an extra console for our telephone at the main front desk. So that we received recently, and then of course the bill shortly thereafter. The larger one, the $5,182.35 is our annual routine invoice for our phone system maintenance charge. That's all on that page. There was a lot of different ones on page 4. Page 5, if we look about right in the middle, voucher number 7 says vaccines, and there are 2 bills there, voucher number 7 and 32, that total $2,637.40 that are obviously for vaccines for public health, the influenza, gearing up for all those clinics. Then just below that, kind of one I had to actually even look up is 33 and 34 for Simon's Rec Complex, and the totaling $690.98. And that is actually for the ADRC Tai Chi classes. They're reimbursing Simon's for their instructors doing those classes from September to November. And then page 6, the last one I have is right at the top is number 17 is our US Postal Service, and that's for $3,000. And that I usually request that about 3 times a year, sometimes less, to load postage money onto our postage meter at the front to run mail through. So that should obviously take us through the end of the year. We are doing a lot more mail. Since people are not coming into the office, we have to mail out a lot more of our documents. So that's just loading the postage meter. That's all I had on that page. Previously paid are pretty routine ones. Quick Trip charge, that's for public health, meals, Genuine Telecom, that's our monthly telephone bill, and then Walmart, just a small charge. These are all, if we don't usually pay timely, we will get charged interest of some sort. So that's why they're on previously paid. And they've already been cut. Any questions?
We're not going to do the budget summary report, correct?
That's correct.
And I will be sending out, I've got an email prepped for you guys to do like Robin usually requested, to have you send an email to me this time, not Robin, and just hit reply to let me know that you're okay with paying those vouchers so we can get the checks cut.
So it would be appropriate for a motion now to approve our monthly vouchers.
I so move.
Motion by Van Nelson to approve and pay our vouchers. Is there a second? All right, we got a second by Debbie Kaiser. You're talking. Is there any discussion? Hearing none, all those in favor signify by saying aye. Aye. Opposed? Motion carried. Next, we'll move on to agenda item number 10, the preliminary 2019 post-audit budget. It should be in our folders also.
Actually, Mr. Chair, there's no written report for this, but I thought it made sense to put this on the agenda to give you the information. I think I mentioned last month that Robin and I had a phone conversation with the auditors to get a sense of where we were. I think they've completed their audit. I don't know if a report has been submitted yet. But they were able to inform us that at the end of 2019, Health and Human Services core budget had $551,951 and some change remaining in our budget that was then transferred over to the general fund. So I think we announced this last month. Previously, I think Robin was estimating quite conservatively that we would have about 340,000 that would be remaining in our 2019 budget, but now the auditors have given us the number. So that's 551,951.
That's pretty good. I was thinking that that report was under number 2, which it is. It just is a different line. It's Robin is asking to approve the transfer.
Can you, Ms. Thorson, can you repeat that again? What did we anticipated it would be? What was that number?
I think we anticipated it would be around $340,000, and it ended up being 551,951.
Wow, that's a significant increase.
Yeah, that was substantial.
Better being less than that. So
Yeah, we were very glad to see that it was substantial, and certainly the next agenda item speaks to the issue with having that money transfer over. I don't know, Mr. Chair, if it might be appropriate to move to agenda item number 12 before we take up number 11. That's sort of to you.
yeah, flexible. We can go to number 12.
Okay. So this would be the placement report. The reason I thought it would be appropriate to go to this because it'll give you some context for when we talk about the agenda item number 11. So under the placement report, you can see that we did have, in terms of adult institutional placements, few less days, 31 days of institutional placement and 46 days in crisis stabilization. So we were had less than what we've had in previous months. The crisis stabilization total expenses was $46,095, and the adult institutional expenses was $626,180. And I'll scroll down to show you the adult residential placements. That has increased, and part of the reason that we have more in placement for residential community placements is because we were able to move individuals out of institutional care into community placements. And you'll see in June, July, and August that the placement expenses have increased quite a bit. And I just want to remind the board that the reason for that increase is that high cost institutional placement that we were able to move out of the institutions, we put into an also very high cost community placement. And even though that is at a high cost, we will be able to receive Medicaid revenue to help pay for that. The bulk of the reimbursement for that would need to come in the reconciliation that we will do next year. And so we are going to continue to incur expenses here, but we do expect to get additional funds when we go through the WMCR reconciliation next year. So in terms of adult residential community placements, the total through August is 176,690. So in Fund 54, which is the adult placement fund, we started the year with 482,278 in that fund. we have had a total of $848,964 in expenses through August. So Fund 54 would be in the deficit of $366,686. Going to scroll down to the child placement. So in child placements, in terms of institutional, inpatient, and detention, that has remained pretty steady throughout the year with long-term institutional placement of a child and some significant use of detention. So child institutional total expenses was $164,248, and the total expense for detention costs was $26,975. And now I will scroll down to the foster care placements. We have had some additional foster care placements that were necessary for safety concerns. Under the group home and treatment foster care, we had 118,681 in expenses through August, and regular foster care 18,661. At the beginning of the year, Fund 44, which is the child placement fund, we started with 527,341. We have had a total of 328,565 in expenses through August. There is 198,776 remaining in that fund. To switch over to a second report that shows you the graph above shows you that monthly cost in placements for 3 years. So each color bar represents a different year. The light blue is, the dark blue is this year, 2020. The light blue is last year, 2019, and the gray is 2018. And as you see that up and down, you can see how variable placements can be. What I wanted to show you is that the Fund 44 and 54 combined at the beginning of the year had 1,009,619. We've been talking in anticipation of any carryover funds that the Health and Human Services might have from 2019, plugging in that number that we just talked about, that 551,952. If that were put into the placement fund, that would give us 1,561,951 total to cover placement costs. Right now, the trend of our expenses, if what we have already expended through August continues in the same trend to the rest of the year, we would end the year with 1,766,294 in placement expenses. If the remaining funds from 2019 are put in the placement fund, we will still be short $204,000 if the trend continues. Now, I will point out we've been following this trend for the last few months. Last month, that trend was looking about $40,000 higher. It really does depend on what's happening with placements. We do know that the month of September, we did have some high placements or several placement days. We haven't seen all the expenses come in with that, but we're still hopeful that this could trend down a little bit more, but it really does depend on what happens with placements. And that, does anybody have any questions related to the placement report and where we stand with placements?
Moving forward into next year, Mr. Chair, I'm sorry if I can speak.
Go ahead, Mrs. Glassburner.
I know that this has been an unusual year with COVID, which may have impacted our placement, but we also know that we've been trending upwards with that. So this year we have that extra amount to put in. But for next year, I guess I'm wondering as far as our plan, because it appears we'll be going beyond again what is budgeted as far as replacement. I know you mentioned getting some reimbursement for the residential placement. Does that factor into how you are thinking we'll approach those extra costs next year? I guess I'm just wondering looking forward, what you're thinking.
Yeah, well, it definitely factors into how we think we're going to continue to cover some of those extra costs. The issue with that high cost placement, like I said, when we go through the reconciliation, we don't know yet whether or not we'll get all of those expenses back. So right now we bill Medicaid for that placement, but what the reimbursement is less than what the placement costs. And so that's why when we go through the year next year and do our cost reporting, the reconciliation will show that our expenses were higher than our Medicaid reimbursement. And therefore we should be getting back all of that. Because it's such a high cost, we don't feel like we have a guarantee with the state that we'll get 100% of those costs back, but we do expect to get a significant amount back. So yes, that does go into our expectation of having some continued funding to help with next year. Right now, because this is our first year using a high cost placement like this, we just don't know where we're going to stand with that entirely.
Into a Category 2 storm as it bears down on the Gulf Coast. Forecasters
Thank you.
landfall Friday afternoon, so tomorrow, strong winds.
Where would that 200,000 come from? County's general fund?
Yeah, you know, if we end the year this year with any remaining funds, the auditors generally take whatever's remaining to cover all of those funds. So whatever we might have remaining would go toward it, but then what if there's still some remaining, it would go to the general fund.
We just got power back on. They've got a lot of tarps still over a lot of the buildings, the roofs, and now we're gonna have this next storm coming on in. You see where
Is there any more questions?
doesn't include parts of southeast Texas because the backside of that storm might bring them.
All right, you think we can move up to agenda item number 11?
Western Louisiana coastline. Here's a satellite image. Certainly getting a little bit better organized.
Approve transfer of 2019 Fund 56 carryover to Funds 2020 Fund 54.
The time they build up more and more storm surge because it's
So
actually-
I wanted you to see the financial picture of the placement fund so that you could have some context for this recommendation. Historically, for many years, I believe, if there were funds remaining in the Health and Human Services budget, the county board has oftentimes allowed those funds to be transferred into the placement funds, either to help build up some contingency within those funds or to cover costs that already existed there. And so this would be a recommendation to the Finance and Personnel Committee to transfer the remaining funds that auditors have identified, those Fund 56 carryover funds, into adult placement fund, particularly because that's where the high costs exist. So that would be recommending $551,951 and 63 cents transfer to Fund 54. The auditors have already transferred those funds from the Fund 56, which is the Health and Human Services Fund, to the general fund. So it would be transferring them out of the general fund back to the placement fund. And this would really be a decision, if this board forwards it on to finance, that finance would need to make.
The continuous undermining of confidence in the vaccine is just.
I would entertain a motion to approve this transfer and to send it on to finance and personnel for their approval and action.
I can make that motion, but I did have a question about it once first.
We got a motion on the floor. Is there a second?
Deborah Kaiser,
Debbie seconds it. Now we are opening up to discussion. Ingrid?
I apologize because I know you guys have updated us on this before, but can you remind me again, where do they think all this came from? Where did we get this?
Those substantial funds. So I can give you some history. So when the 2019 budget was developed, it was developed in anticipation of not receiving all of our allocations from the state. So that's one of the major factors. And I apologize, without Robin here to help fill in some of my gaps, I may not get the whole picture for you, but when the budget was built, so I'll step back one more step. So when we have institutional placements, rather than submit a bill to us, what the state does is they just take whatever is owed out of the allocations that we have with the state to pay for our programming. And because the state had continued to do that, the budget in 2019 was developed in anticipation of not getting all of our allocations to cover our program costs. So the budget was anticipating not having those funds. What we did with that chargeback process is we developed something with the auditors where we could keep those allocation amounts to address the program needs and charge that back to the placement fund. So we have not rebuilt all of our programs in 2019 to need to utilize all of those allocations. Some of the surplus, I guess, in the Health and Human Services Fund is a result of having not budgeted for like improving and expanding our mental health services back to try to meet the community needs. We weren't having all those expenses yet in 2019, but we were able to charge back and keep those allocation amounts from the state. So that's one factor. We also got some unanticipated funding from the state. We also improved our billing and collections. So there's a lot of factors that come together.
Thank you. That was a really clear explanation.
Do you have any more questions on the motion? Hearing no questions, call for a vote. All those in favor of transferring $551,951 to Fund 54, signify by saying aye.
Aye.
Aye. Aye. Opposed? Motion carried. Moving on to agenda item number 13, the 2020 contract monitoring report.
Okay, so that's me again. So Tracy's going to share that screen. There it is. So these are all the, it's not every contract we hold with providers, but these are anything that's over $10,000. And how this report is organized every month is based on the manager that's responsible for it. So if you see right at the top of page 1, the Southwest Wisconsin Workforce Development Board, that's one that I monitor, how much we've got approved to spend, what we have expended, what our current month that we've been invoiced. how much we have left to currently charged and our balance. So what I like to look at is on the far right-hand side, the percentage utilized. And right now, it's like I said, again, this meeting is early in the month. So we hadn't received a lot of September bills at all. We're looking really at August, which the percentage of utilization for August would be 67%. So on the far right, I'm looking for anything in excess of 67% utilization. So going through these vendors, the one right in the middle, Family and Children's Center, is at 85% utilization. And they have billed us through August, but that is one of the providers we do not anticipate using much more through the end of the year. So that will trend actually just fine. I mention that one every month because it exceeds every month until eventually it'll balance out. Page 2. I should back up just a little bit. The first page, I missed that's all the managers to help explain this a little better. That the manager, those are all the contracts through with Jessica Stanek, which is the Child and Youth Services Unit. Page 2 is a little bit more of Jessica's contracts that are larger than $10,000. And then it starts Lori Cooey, who is Children's Long-Term Support and also the Birth to 3 program. So these are all trending well or underutilized at this point on the far right. Page 3 continues Lori Cooey with those children's providers, and then starts at the bottom with Miranda, who is Behavioral Health Services, or CCS, as well as probably the biggest program that these providers assist with. And on the far right-hand side, looking at percentage utilization, there is nothing over 67%, so we're okay. So we'll go to page 4, continues Miranda's contracts, and second up from the bottom is Cario, which is at 71%. But if you go a couple columns to the left, you'll see that they've already invoiced us for September. So they're already ahead of the game, and they are trending just fine. Page 5. There are some that are right at the 66, 67 mark. But at this point, we're just looking at 67% or over. So, I'm watching these ones. For example, Northwest Counseling and Guidance Clinic is right at 64%. And then right at the bottom, Tolarian is at 60, almost exactly 66%. So we're just watching them closely to see how they trend. And then page 6 wraps up Miranda's contracts, and then Rose has other contracts, but this one is the only one that tips over the $10,000 mark. That obviously she does some work providing with some of our other county departments, and those aren't listed on here either. So far right, everyone is trending over or under the 67%, except Winnebago, which we have talked about. That's our mental health institution. And that one, as we've talked about every month, is over.
That is not actually a contract, but it's tracked here, so.
Yeah. Yep. The actual, when I had to put a contract amount in this database, so that's why I keep increasing that every time that it, so it's at 600,000 right now, but actually there isn't a contract dollar amount max that we have for that.
Thank you for your report. Are there any questions on the contract monitoring? All righty. Move on to agenda item number 14. Thank you, Angie.
You're welcome.
You would approve updates to 2021 Health and Human Services budget.
So there is a handout titled 2021 Health, or probably HHS budget, in your iPad. There's really nothing to approve, but it's on the agenda as a potential approval in the event that we were needing to make further adjustments to our budget. So on September 29th, the Finance and Personnel Committee approved a motion to forward the 2021 proposed county budget on to the county board for final approval. Last month, we gave you what our status of the proposed Health and Human Services budget with $120,000 reduction in our tax levy. And so I wanted to give you a final version of that. So the 2021 budget that was accepted into what the Finance Committee is moving on for the whole county budget did not change since last month when you saw this, other than the health insurance amounts are less. So this 2021 budget for Health and Human Services assumes that we have a reduction of $120,000 in tax levy. There are no pay plan increases to staff salaries other than the scheduled step increases already allowed. The health insurance increase, we now know that that's 3.99%. The plan to transition 6 of our existing full-time Southwest Workforce Development Board leased positions to county positions remains in this budget. We would need to come back to you probably next month after the budget is finalized to make those requests for approval. There is also still a plan to create 1 new crisis APS position, which is funded primarily from increased state reimbursement provided to the counties who regionalize for crisis. And also in the plan is to fill one of the vacant public health nurse positions in order to ensure that we have adequate staffing during the pandemic and ongoing for the public health needs. Tax levy was shifted in our budget to accommodate that and make sure that we had funding for that.
Including universal healthcare.
Pardon me. So these are the same numbers that you saw last month. We have a $6,882,554 budget for Health and Human Services for 2021. So that's what was put forward to the Finance and Personnel Committee at the last meeting. And so that is what is in the budget that will be proposed to the county board. I just wanted to make sure you had that update as to what has happened, and nothing essentially has changed.
As a freshman member of the House, she has an outsized role.
Tracy, with those 6 leased employees from Southwest Workforce Development becoming county positions and being cost neutral, does that include their benefits package?
Yes, it does.
Is there any further questions or additions to that? All righty, we'll move on to agenda item number 15, personnel updates.
All right, I'll share my screen again here. So you have this memo in your iPad folders with all the personnel updates. So just a reminder that since some of the handbook rules have changed, that this is now something that actually gets approved by the county administrator or at least reviewed with. So this is really for the board's information only and doesn't require action. We have had no new hires in county staff since last month. We have 2 staff who have completed their probationary period, or I guess will as of the 13th of October. That's Aubrey Bruckner, Economic Support Specialist, and Tony Cabrera, also an Economic Support Specialist. No dismissals, suspensions, or disciplinary action to report, no terminations or layoffs to report. We do unfortunately have to report a resignation Claire Stoffler, substance abuse counselor with us, is going to be moving on to another position closer to her home. That will be effective at the end of the month on October 30th. So we're sad to see Claire go. Southwest Workforce Development Board, we have added a leased staff secretary, Deborah Mitchell. That's an LTE position, and it is effective of this past Monday. We are looking at whether in our 2021 budget, we did include continuing this position into next year. Right now it's an LTE position, and we'll have to make that decision going forward, but it is part of our 2021 budget to keep that to help with the workload. No leave of absences to report, and I think that is the report for personnel.
All righty, thank you. Let's move on to agenda item number 16, picking a snow plowing provider.
Yeah, so this one is me, and I think Tracy is probably working on sharing the summary.
Yep.
And there we go. So historically, we have, other than the last 2018 through 2020, we have always had to put out for bid selecting a snow plowing vendor. This has been done for many, many years. When I first started, it was annually we had done it. And then we really ended up with the same vendor every time. They asked, if you'll see here, from 2015 to 2018, DNP Enterprises was awarded the contract, and he was able to offer us a little bit better pricing if we secured him for 3 years instead of doing something every year. That we fulfilled that contract with him, spent roughly $4,488 that year. Every year is different, as you know, with snow. So then we were approached by the Courthouse Property Buildings and Grounds Committee, talking about ways to be collaborative in sharing either the staff or the equipment between the two buildings, the courthouse and our community services building. They had some different staff turnover and things. So in that moment, they had decided to reach out to the city and see if they could do the snow plowing and actually also the lawn mowing for both buildings, which started in 2018. That contract was supposed to run through 2020, but we received notification in early 2020 that the courthouse wanted to terminate their contract with the City of Richland Center, and that left us with no lawn mowing all summer and also no snow plowing services then for the remainder of 2020. That City of Richland Center, when we had one full year contract, it was $6,170. We have since been talking about, I will say the lawn mowing, what was nice, and I don't know if it's going to continue or not, but I hope so, is that Randy at the courthouse, their maintenance person has agreed all summer to just come over and mow the little bit of grass that we had. So to give you kind of an idea, we have no outbuilding, we have no place to store gas or anything like that. We've had really, we haven't had a maintenance man on site full time until recently, the last year or so. So we've really taken advantage of Randy's generosity this summer, but I don't know if that's going to continue. I hope so. But going back to then snow plowing, that is not something that I believe in all of my years of conversations with the courthouse committee and that maintenance position that they're willing to do at both buildings or have the capacity to do both buildings, honestly. So Tracy and I talked, we decided to put requests for bids out a little earlier this year, simply because, well, one, COVID, two, the weather was getting cold already, and three, we haven't really solicited for bids since 2015, roughly. So I was struggling with who these new players are in the community that might do snow plowing. I went back to my lists. I went to the phone book, I went online, and I mailed the bids advertisement, which was obviously placed locally in the papers, but I mailed out 10 of them. And then I know another 3 or 4 of these bids were picked up from vendors at the main front desk. So the bid submission deadline was the 25th, with a target of presenting whoever we've received bids from at today's meeting, so we could get things in place well before November. So we received 2 bids. One was Bindle Snow Plowing and the other one was DNP. And I've listed their rates kind of side by side for you there, so you can see that comparison. And then I also attached their actual bid in the packets for you, as well as our snow plowing bid specifications, what our bid requests look like. One of the hardest things probably as I talk to both of these vendors is what happens during the day. We request, I believe it's 1 inch. If we get 1 inch of snow, they have to come back to the building and remove the snow, resalt. That obviously can be very difficult if you're trying to do other projects or other jobs as well. So both of these vendors felt they could meet that requirement. A lot of times getting on our grounds and getting everything cleaned off from the night before has to be done before 7 a.m. And that is probably why it's not worked to have that collaborative use of the for the 2 buildings with one person doing the work. It's just hard for them to do both buildings, get everything done before 7 a.m. So this is where we're kind of left with the 2 vendors and going back to paying for this service through different vendors. So we have Bindles is $58 per plow, where DNP is $65. And if you've been in our parking lot, you know the complexities. There's all sorts of tight areas and things they've got to maneuver around. There's the trucks and vehicles and vans that are left overnight. It's a very hard maneuvering parking lot. So that could be why some people wanted to bid it and then came and looked at it and went, oh boy, I don't have small enough equipment. Then you've got all of the sidewalks around the entire city block. Of course, our building is right up next to a lot of those, and we've had scuffs and things over the years where they've scuffed the stucco and we've had to have insurance claim and all that kind of stuff. So plowing our facility is not the easiest, and the other piece is the routine salting. Now we do have a maintenance man in-house that throughout the day kind of helps by the doors, but to actually physically go out and salt the parking lots down, he doesn't have that equipment. Sidewalks, so that's where Bindles is $75 to do those salting in the parking lot, and DNP was $50. The sidewalks are, like I mentioned, a little bit complicated, and Bindles was $100, DNP was $60. The reason I put the little Bindles is salting time is another $50 if he has to come out and do all the salting of the sidewalks again. It's not the $100, that's for salting and shoveling, or however they do it. But if he's got to just come and salt, it'll be $50. Then we get the tricky part, which is what the debate has been for years, why we have to pay to have snow removed, the piles removed out of our parking lot, when other county government buildings, the city lets them push it into the street and then they get rid of it. So this is a piece that still, as far as I know, we have not been given that exemption again, like the courthouse has. And for years we've talked to the mayor, we've talked to the city officials, trying to see if there's some way we can't get the same benefit as the courthouse. That's where our expense usually is that you have these multiple small parking lots that build up these snow piles. And once, my rule has usually been, if they're taking up 3 to 5 parking stalls, they got to come in on the weekends, nights, and remove that snow. They are not allowed to push it out into the city street. So that can be kind of problematic. I'm hopeful this year, and pricey obviously, but I'm hopeful this year with a lot of people working from home that we may be able to get by with not having to have as much snow removed off our property, but time will tell. Every year is a little different, and roughly we budget, if we continue down, roughly we budget about $6,000 a year. I think $6,500 is what was budgeted this year. It's really been trending right around $6,000. Does that help explain everything? Anyone got any questions? I mean, we're recommending bindles this year because the price is lower for plowing. The removal is lower. The sidewalks kind of balances out if you look at if it's just salting versus salting and shoveling. That's the other thing that was kind of a big deal with the courthouse when we were collaborating with that, was who's storing all the salt, who's that kind of stuff. We don't have that kind of capability, spreaders or anything like that to be able to do that kind of service. So we really are reliant on getting a different provider to take care of the parking lot for us.
All righty. Who will it be, Bendel Snow Plowing or DMP Enterprises? Take your pick, make a motion.
I will say, I said that DNP we've done business with before. They had I had no issues. They did a nice job. I've not worked with Bindles in this capacity here at the Community Services Building. I don't know, but I know they do a lot of snow plowing around the community too. So I feel confident in their skills as well.
And this contract is how long? How many years?
So it would start this fall, and then it continues through.
Right.
It would be the spring of 2023.
2023. Okay.
Yep. And then I usually bid it out all over again. We'll start again. Usually look at things August-ish, get it in the paper, September.
Right. I was just curious because I do it myself too, so I didn't know how long your contract was originally. So that's why I kind of have a knowledge of some of that stuff.
So 3 years
But
is what?
I'm good with either one. So.
Oh, okay.
So who will the committee pick, Bendel Snow Plowing or DMP Enterprises?
Did you say that you're
I'll make a
recommending-
motion.
I'm sorry. So you did recommend Bindle? Is that what you thought?
That was, I've not done business with them myself, but I do know them from the community, obviously, and they do a nice job. I don't think they've actually bid here before. I've not seen them, and I've done this probably 18 years, 15 years.
It looks like their cost is a
Right.
little.
When I first started plowing, I plowed for Bindles for, I don't know, 5 years, and I don't ever recall doing anything in Health and Human Services.
Mm-mm.
And then I branched out on my own, and I've never seen them there since. So I believe this is their first time.
I've sent requests, and that's how we got this one, is I mailed it. He was one of the 10 that I mailed to.
Right. No, I say go ahead and make a motion to go with Bindle Tire and Auto's bid and for the snow removal through 2023.
I have a motion by Supervisor Wagner to go with Bindle Snow Plowing for
I
a
second
contract
it.
of 3 years.
Kaiser.
And we got Debbie Kaiser that seconds that motion. Is there any discussion on snow plowing? Hearing none, all those in favor signify by saying aye.
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 And Carrie, I just wanted to clarify, when I say that there's a $6,000 contract that's annual, or a budget, I should say, that's annual, that covers the spring or up, I'm sorry, January through roughly to the spring. And in that same year, the fall, winter. So does that make sense? So in where the snow season carries over 2 years, but the active contract will be just for that 1 year. So his contract this year will be just for 2020, just those 3 months, which wouldn't be the $6,000. Then we have to do another contract effective January 1.
Okay.
September 22nd, and accordingly, the third debate should then be shifted back.
I would say the motion carried. So we'll move on to agenda item number 17. These contracts are quite lengthy and have multiple pages to them. Hopefully everybody did their homework and looked through them. If not, I don't know, what are you thinking on how to handle all these, Tracy?
Well, I guess it's up to the board if we can go through each category and just let you ask questions about individual ones, or if you'd like, we can kind of give you just a quick, this is what the contract is for, and just go down the list.
Stop playing politics with people's lives.
What is
I'd
the
be fine
committee's
with that.
wishes?
Maybe just a small review, since I'm new to the board.
In the state of Arizona, we'll see if they weigh in for.
Sure. So I think you should be seeing the summary number 5 that was revised because we had to add on to that. Let's see. Miranda, can you speak to the amended contract that we have before the board?
Sure. So for Schmidt Consulting, that's Paul Schmidt and Jessica Leinberger. And we work with Paul for substance abuse consultation and supervision. Another thing that we're adding at this point in the year, we've been working with Paul to use the prevention portion of our substance abuse block grant, so funds that we already received from the state, to work on implementing those in the community and with Ithaca and Richland schools. So I'm working on a project getting those prevention funds and a curriculum related to substance abuse prevention implemented in the schools.
And I think because this is an amended contract, it needs its own motion.
I would entertain a motion for Schmidt Counseling LLC.
I do, David Kaiser.
Debbie Kaiser makes a motion to approve Schmidt Counseling LLC. Is there a second?
Second.
Seconded by Mr.
Second.
Nelson. Is there any discussion? Hearing no discussion, all those in favor signify by saying aye.
Aye.
Opposed?
Aye.
Motion carried.
And then we do have a new contract for 2020. Angie, are you able to speak to this?
Yeah, so this is largely due to COVID for a couple different reasons, not just staff issues, but also in my conversations with Ganders, if we run into a need for a fogging device or something done to eliminate COVID from our office, maybe a specific area or space. We don't have windows to open. We're really kind of a locked in facility that he has some different devices that he could use as well if we needed to get some fogging done to eliminate COVID. So we haven't, luckily, knock on wood, had really too bad of a situation. Largely, this contract is in place because we are down 2 maintenance and cleaning people. So one is our full-time and the other one is our part-timer who actually works for the Richland Hospital full-time. So his capacity is too large at the hospital and he is not willing or able to help us out, I should say. Just doesn't have the time to come and do any sort of evening after he works his full-time job at the hospital. So we are looking for, we were looking for a solution. Our building has to be cleaned every day. We actually wipe surfaces down every 2 hours as well. And we've figured out, management has figured out a way to get that done because Ganders can only come in the evening, and make sure that the bathrooms, we have 7 restrooms, break room, conference rooms, all of the public areas really get a nice cleaning at the end of every day. We're hopeful that we will have our full-time person back within 3 weeks. But as we all know with COVID, that's uncertain. And hopefully this contract is just through the remainder of 2020. In case we need any fogging, any specialty COVID additional assistance to clean and keep the building sanitized while we continue to remain open to the public too. My guess is we will, if COVID continues with the need to continue all this sanitation in 2021, we will probably ask for this kind of same on-call emergency kind of contract then. But for now, it's just getting us through this real dire need we have right now that literally just happened, and we need someone to clean.
So just to add to what Angie's saying, this
Right,
was
and
kind of a scramble. I'm sorry, go ahead.
So I talked to Tracy on the phone briefly about this, and I would suggest that after this contract agreement is over, that it be broadened to the horizon of other companies, because I know that Ganders was in there for a period of time, and from what I recall, they were released from their duties there. So I understand what Tracy said. They're in a pinch. They didn't know who else to call, but there are other companies, excluding myself. I know I can't get involved in it, but there are other companies that I think would deserve a shot as well.
So maybe that's what we look at for 2021, as you're saying, we put it out for bid. If know that I've been working with Ganders for probably 15 years. They were not let go. What happened was it was a cheaper alternative to hire in-house, and we needed people in-house during the day in case there was cleaning needs. We had always had 2 that kind of took care of things in the evening, and then we found we needed someone during the day. So that's why recently we've added the full-time person who is leased, that we hope to transition into a full-time county position. Just like the courthouse has 2, we would like the same thing or need the same thing. But what we've realized as well is that when you only have 1 full-time person to do this kind of work, if something happens, you got to have a backup plan. And our backup plan was a leased position, and that backup plan didn't work either this weekend. So literally I went to who I knew the building, knew the lay of the land, and we could really come in quickly on Monday and just take it on. But I'm not opposed to putting it up for bid next year at all.
I'm just saying for a future.
Yep.
Yep. So.
All righty, are we looking for a motion to accept Gander Cleaning Service for contract?
I motion it.
A motion by Debbie Kaiser to accept Gander Cleaning Services contract. Is there a second?
Second.
Seconded by Mr. Nelson. All those in favor signify by saying aye.
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 Opposed? Motion carried. Move on down the line. I think we are at B, 17B.
Yes, that would be revenue contracts. So that's summary number 6. And I'll just give you the overview, what we are required to present to the board our contracts for revenues. And so this list is the various contracts that we have where we receive revenue to help fund our services. If you would like, I can go through each of them. Would you like that?
I did my homework and looked through them. I'm not sure what other board members have done. It seems it'll take up quite a bit of time. You do that. I think maybe you can go over the high dollar ones.
Sure.
Probably about close to $1 million.
All right, so Dane County Capital Consortium is the second one down at $980,000. That is where our funding comes for our economic support services. Then I will go to Department of Children and Families. This is a state and county contract for $517,890. That's with the state that funds our child and youth services primarily. The Department of Health Services state and county contract is $1,063,000. Those are all of those allocations that I keep talking about. So when you break those down, those are broken down into various amounts that cover different programs. And I'll scroll down a little bit more. We have contract with the Greater Wisconsin Aging Agency on Aging Resources for $165,551. That's called GWAR. That's what funds our aging programs, including the nutrition program, as well as the caregiver program. Those are all of the aging programs that are both in public health and the ADRC. And I think some of that funding also helps with our adult protective services. I think that's kind of the bulk of the large contract. Are there any questions?
Do we need to do a motion to approve this?
I believe so.
Yes, and these also need to go on to the county board. So I'll be prepping that as well.
All right, I would entertain a motion.
So I'll make the motion to approve this.
Motion
I
by
second it.
Motion by Dr. Barris.
I second it.
Can I ask a question?
Yep,
Did
since we
you
got a
say-
motion in a second.
Oh, sorry.
Go ahead.
Did you say why we didn't have the contract for Southwest Cap?
I did not. Actually, Southwest Cap, that contract, they were administering a contract that came from the state of Wisconsin, and they backed out of continuing to administer that. And so it's coming directly to Health and Human Services from the state.
Okay, thank you.
Yep.
Do we need to, all those in favor, Terry?
Sorry, I was paying attention. So all those in favor signify by saying aye.
Aye.
Opposed? Motion carried. Move down to 17C.
All right, so I believe these are the contracts that are less than $50,000. Oh, excuse me, greater than $50,000.
Yes, there you go. There you go.
And I think we have quite a few of them. Not sure if you'd like me to go through them or if you would like to just ask questions.
Ask questions.
I agree with Debbie.
So a lot of these on the first page, I'm assuming we have higher contracts with them because you've been working on more residential placements and getting them the licensing that they need. Is that correct? No.
It's probably a little more complicated than that, but that would be one of the factors, certainly. So many of these contracts you'll see are related to like the adult family homes and those kinds of placements, which we do try to draw upon CCS Medicaid funding for. So you'll see a lot of those, as well as some of the providers, such as Driftless Counseling, you see is a $900,000 contract. They are one of our contract providers to do the CCS mental health and substance use services, which again is fully reimbursed by Medicaid dollars. So many of those, any of those trying to build and expand some of our mental health services is done with the goal of helping keep people in the community and avoid the need for more costly placements and institutionalization.
The first one on the page, because there's quite a bit of increase there as far as the contract. Can you explain that one a little bit?
I'm sorry, I'm not sure if I understood you, but I'm gonna probably think that Miranda's gonna be able to answer it.
Or I can, the, a golden star actually was just added. The reason why the 2020 is so low is because it was just added. And where the 2021 is for the full calendar year.
Okay.
Does that help, Ingrid?
Yes, thank you.
That was the simple answer, Tracy. Yeah.
Looking for a motion to approve this and send it on to county board?
Really quick before you do, the Vista Care or Vista Care, that one has an increase too.
Is that at the bottom?
That's the very last one.
Yeah,
It would
so
be the
you
similar,
probably
yeah.
recall that we did start that
Okay.
mid-year or a little later in the summer.
I also just wanted to note that that column that says county tax levy funded, yes, no, partially, that's on here. Know that I do provide all this information to Ben. I have for years, and a lot of times he pulls that from the resolution. So hopefully I will be able to convince him to leave that in there again. But the last couple of years, I believe it's been pulled.
I entertain a motion for approval.
Debbie Kaiser. Debbie Kaiser.
Debbie Kaiser makes a motion for approval. Is there a second?
Second.
Seconded by Mr. Nelson. All those, is there any discussion? Hearing no discussion, all those in favor signify by saying aye.
Aye.
Aye. Opposed? Motion carried. On to 17D.
So this would be summary number 8 for contracts less than 50. These are when their contracts are less than 50,000. Of course, it does not need to go on to county board approval. This board is able.
Question for that one on the Southwest Wisconsin Workforce Development Board. There's a large decrease in our contract.
And that's the one that Tracy had mentioned earlier. We're hopeful that 6 positions can transition to county.
Okay.
As long as that holds true, then otherwise we would come back in November and ask for that to be increased, or December, and if that doesn't happen.
Okay, thank you.
We talk about the Southwest Workforce Development Board.
Yes, that's what Angie just mentioned. So that's the moving those staff from leased positions to county positions would decrease the contract.
Okay. I'll entertain a motion for approval.
I'll make a motion.
Motion by Ingrid, seconded by
Debbie.
Debbie Kaiser for contracts less than 50,000. All those, is there any further discussion? Hearing no discussion, all those in favor signify by saying aye.
Aye.
Aye. Opposed? Motion carried. We'll move on to 17E as in Edward.
This is summary number 9. These are considered agreements rather than contracts for any amounts less than 10,000. I don't know if there's more to say about that, Angie.
No, that's right. I did want to point out that way at the bottom, I left a blank box for whoever you awarded our contract for snow plowing removal. And we will, there it is, the bright yellow. So it'll be for $6,500, and I will add Bindle snow plowing vendor in there.
Just out of curiosity, the autism one with our in-case contacts, are we utilizing that quite a bit? It's the third one or fourth one down. We must be if we're increasing the contract.
I can let you know that with the children's with disabilities contracts throughout these 3 sheets that you've seen, and through the contract monitoring that I do, they're almost, it's hard to find every month where they're at because it's just a pass through of dollars. I hope to have a better grasp of that next month. With Robin being gone, I wasn't able to get those quickly this month. I know maybe Miranda can explain how they have to add someone to the approval process if one parent wants to use it, use the service, but it doesn't always happen really timely. So Miranda, I don't know if you want to speak more about the children with disabilities contracts.
Yeah, no, I think Angie described it really well. It's a walkthrough of dollars for families. I don't anticipate it is kind of doubling in the contract size, but we don't anticipate a lot more use, but just rather their increases for next year. Their increases in what they charge for next year.
Okay.
And I will say a lot of those children with disabilities contracts, Lori and I over the years have found it's better to make them not agreements, which are really small requirements. We actually put them in the contracts category. So to tip that over, you've got to have a contract for over $10,000. And then the requirements and the language and all of that is a lot more strict for those providers. She will probably have never an intention of spending 10 to 11,000 with those vendors, but it's really about which documents they have to sign and provide to us. So that's why you'll see there's a lot of underutilization of those contracts that are around the $10,000 mark. It's really about the paperwork behind the scenes.
I'll entertain a motion.
I make a motion.
Debbie Kaiser moves to go into an agreement with our providers for less than 10,000, and I will second that. Is there any discussion? Hearing no discussion, all those in favor signify by saying aye.
Aye.
Aye. Opposed? Motion carried. Moving on to 17F, Memorandums of Understanding.
So this is summary number 10. Memorandums of Understanding, or MOUs, are done with other parts of the county because we can't contract with ourselves. So that's why we have these, even though they may be larger amounts.
Need a motion for the Memorandums of Understanding.
I make a motion, David Kaiser.
Debbie Kaiser makes a motion. Is there a second?
Second.
Seconded by Dr. Barris on our Memorandums of Understanding. Any further discussion or any discussion? Hearing no discussion, all those in favor signify by saying aye.
Aye.
Aye. Opposed? Motion carried. Moving on to agenda item number 18, approve state opioid response prevention services grant.
Sure. So this is an extension of the SOR grant funding that was good through September 29th. We're reapplying for that funding to support a full-time treatment substance abuse counselor, a part-time counselor, and then to have the staff coordinate and update services within the community and referral services. So the funding that we are requesting is $109,044,000. In addition, the grant previously only covered opioid use disorders, for consumers that came into services, and that's been expanded under the new grant that we'll be applying for to individuals suffering with stimulant use disorders.
And down at the bottom, it's broken down into where the dollars will most likely go to. But we would need a motion so we can send this on the county board for approval. I would move to send this on to county board for approval. It would be for the state opioid response and prevention grant.
I second it, Debbie Kaiser.
Debbie Kaiser seconds. Is there any further discussion on this grant? Hearing no discussion, all those in favor signify by saying aye.
Aye.
Aye. Opposed? Motion carried. On to agenda item number 19, approve the purchase of a laptop. I think there's multiple laptop computers in this one, 3.
Yes, that's correct. So one purchase was already made as an emergency purchase. I had contacted Carrie, our chair, to request that. We had a staff person starting in behavioral health, and we had given that computer for that vacant position to public health because they needed one. So we had the person coming and no computer, and so we went ahead with that purchase. But we also have a need for additional laptops. And am I right that it's 3? Yes, there we go. Just making sure.
Sorry, I was just doing the math. It's 4. That's 6,712. I missed changing the 3 to a 4.
Okay, so for that 6,712, that's for 4 laptops. 2 are in admin, and that is to accommodate work from home or remote work to try to address the COVID concerns and potential for spreading or avoiding spreading of the virus. 1 is for the ADRC, and then that other one, I think we talked about whether we are calling that for behavioral health or for public health because of that exchange of the free computer. These are funded through the COVID CARES funding, as well as some funding through the ADRC.
We need a motion for approval of 4 laptop computers.
Make the motion, Debbie Kaiser.
Debbie Kaiser makes a motion for approval of 4 laptop computers. Essentially, it would be 3. It would be getting 3 since we already have 1 of them already. But we need a motion to purchase 4 of them. So, is there a second? I will second that motion. Is there any discussion on the laptop computers?
Can I ask a question? I wasn't
Sure.
really certain. We're over $5,000 about having to go to county board with this, or because you guys already approved the 1, then we're under. I wasn't quite sure if I need to send this on because we need staff, computers, laptops ordered right away. And if we've got to wait another month, that's my concern.
So I guess what I would wonder, yes, we do need them right away. I think this does have to be approved by the county board. I wonder if the board would consider the purchase of the remaining 3 also an emergency related to getting those so that we can respond to our needs due to the COVID crisis. That would allow us to go forward. We would still take it to county board and ask for their approval for the purchase as well.
And when I did the math, even 3 is just tips over $5,000, 5,034.
Yeah.
So, yeah.
It's a good question. I'm not really positive on that. And Ingrid, would you know?
About which part?
About if we have to send this on the county board for approval and wait, or can they just go and get them?
We've been trying to address this, the amount. But it hasn't been finalized yet. No. I don't know what to say with that. I feel like this is because of the split. I feel like you could argue either way.
Mr. Chair, the board rules allow for emergency purchases. We did do this early on in the pandemic where we made some quick purchases, but it still needs to go on for the regular approval process. So I guess I would pose that this is an emergency purchase because without these laptops, we cannot move our staff to a remote work setting. And what we're trying to do is minimize the amount of contact with the pandemic surging right now. So if you like, we could pull up the rules of the county board if that would be helpful, or but that's where I'm coming from.
I mean, do you anticipate you'll need them before the next county board meeting?
Yeah, that would be, so the next county board, of course, is at the end of October, and we would certainly be able to get them in and take action with our staffing prior to that.
And Tracy, you said we're getting reimbursed for these. It's not really going to cost the county any money.
That's correct. We will be submitting for COVID CARES funding as well as some of that ADRC funding that's in the summary.
The other caution with delay is the more we delay, the harder it is to get laptops. It's been too. So that I'm hopeful we can get those turned around pretty quick, but.
I'm fine with you guys just purchasing them. What do you think, Terry?
Yeah, I'm fine with that.
Okay, so I can make, did we have a motion yet? I'll make a motion if we didn't.
We did have a motion? Yeah, because I seconded it.
Okay,
So,
so now we're just going to the approval part. Okay.
yeah. So all those in favor of purchasing the laptop computers and getting them before county board's approval and asking for forgiveness later, even though this is an emergency purchase. All those in favor signify by saying aye.
Aye.
Aye. Opposed? Carried. Moving on to agenda item number 20, adjournment. Debbie, you want to adjourn the meeting for us?
I adjourn the meeting.
Debbie, adjourn. Is there a second? Seconded by Dr. Barris. All those in favor signify by saying aye.
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 Thank you all.
Opposed? Motion carried. Thank you all for this long meeting. I enjoyed it.